Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center, reporting for the week of April 10th, 2023. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. So we're going to start off with a map that we haven't looked at here before, but I think it is interesting, especially in light of the fact that we can no longer really rely upon total COVID case counts, especially across all of the different countries in the world. And what this map is showing is the weekly change. So it's measuring the percentage of change in the number of confirmed cases in a country over the past 7 days, compared to the 7 days before that. So this should give us some indication of the direction that things are going. So I kind of like this map of the world as opposed to just total cases, because really what we're seeing now is that from country to country, it's difficult to compare. It's really comparing apples to oranges, and just different countries have different access to testing and so on. But with this map, we're really comparing the same country to itself over time. So I think this might be a good place for us to look to help us understand the directions that things might be going. And here, where the warmer colors are representing a larger increase in the number of cases. The largest increase we see here is Burundi in Central Africa, which has over a 200% increase in positive cases compared to the week before. And then we have another number of other countries with a little over 100% increase. Those include India, Chad, and Afghanistan. You can see here that the United States has a very slight change. It's kind of neutral. It's only about a 15% increase. And then all those places that are in the blue shades appear to be on the decline. Now, we don't know if that's just a decrease of testing, but again, at least this is showing a change from week to week within the same country. So we'll continue to keep an eye on that. And as I mentioned, cases here in the United States are relatively flat in terms of confirmed COVID cases. So even though we know that this is an undercount, we should be getting more to a place where this is a more steady state than what we've seen before. So things have been all over the place in terms of everyone getting their tests at a place that was reportable, to more people doing the home testing. And even though we're sort of seeing still a decrease, I think week over week, in how many tests are done, once this starts to sort of level out, I think it will be a more helpful indicator. So even though it represents a small percentage of total cases, we're not seeing kind of wild swings in testing behavior. And so at some point, this should become a little bit more helpful indicator as testing behavior kind of stays steady from month to month to month. So we'll see if that holds true, if we have another surge, if more people start going to get the types of tests that are reported. But for right now, we'll keep looking at it, knowing that it is becoming less helpful. Looking at community transmission. And again, this is still taking into account new cases, but it also takes into account percentage of positive cases. So it's those two indicators together. And we can see that about 50% of the counties in the US are either in substantial or high transmission zones. That's down just a little bit from 53% last week. And we can see that there's quite a bit of variability from state to state. Alaska looks like all of it is basically either in substantial or high transmission. And when at first, when I looked at the state of Iowa, I said it's all blue, which would indicate low transmission. But after further digging into it, I found out that Iowa is actually no longer reporting its weekly COVID-19 cases to the CDC. So that is apparently now a state by state decision, which is really unfortunate. But we'll see if any other states follow suit after Iowa. For right now, there are a couple of states that are reporting slowly, but I was the only one where we've seen a report that they are no longer going to report to the CDC, and they also took down their dashboard as well. Most of the state of California is in moderate transmission. That includes right here in the Bay Area. And we know that historically in this pandemic so far, at least the past couple of years, April has been the month with the relatively lower transmission. This year appears to be no exception so far. But unfortunately, we still haven't gotten down to the low level of weekly deaths that we had last April 2022. Our current average daily deaths is 249 per day. This equates to over 1,700 deaths per week. Still far too many people losing their lives. And once again, the lowest weekly number of deaths that we've had for the entire pandemic was actually in April of 2022. So a whole year ago, and we had 1,347 deaths that week. So every single week since then, for almost a whole entire year, we've had more deaths every single week since then. So as I've been saying, we're plateauing at a rather high rate here. We would like to definitely see this come down. Looking at our variant proportions, we can see that XBB.1.5 and XBB.1.5.1 do continue to kind of creep up. They're now projected to make up together over 90% of strains in the United States. We know that these two subvariants of Omicron are highly, highly transmissible, the most transmissible strains we've really dealt with so far. And so we know that there's still quite a bit of COVID in our environment, and that one person can infect more than one other person, oftentimes, especially if we have events or venues that become outbreaks or super spreaders. We're definitely hearing of multiple positive cases from one positive individual. One of the up and coming strains that we've been keeping an eye on is the XBB.1.9.1. That went from 2.5% a couple of weeks ago to 4.6% last week, now at 5.1%. Interestingly, Region 7, which includes Iowa, the XBB.1.9.1 comprises over 18% of their specimens. So it would actually be rather useful for us to see what Iowa's cases are looking like, to see if this is driving any kind of increases in cases. But since they're not reporting, it's just another blind spot in our ability to monitor the data. And so we're just continuing to try to keep up with all of these places where we're losing our line of sight. But one thing that does continue to be required reporting is hospitalization. So that's something that we'll continue to keep an eye on, especially if we see in one area where, let's say, a variant like XBB.1.9.1 continues to take over. That variant first appeared on this tracker in late February. We've been keeping an eye on it because it does appear to be the first variant that has increased transmissibility over the highly transmissible variants we're already dealing with, XBB.1.5 and XBB.1.5.1. Here in Alameda County, overall cases are pretty flat, and the total number of tests being performed continues to decline. We do see a little bump up in the test positivity rate, which is now at 6%. Hospitalizations do appear to be slowly coming down a bit, with 68 in the hospital, 11 of those in the ICU with COVID. When we look at our wastewater concentration for Alameda County, we do see a little bit of a bump up, as well as for the city of Oakland. So we'll just continue monitoring our wastewater, and wherever you are, you can also check out wastewater in your area. We still have a lot to learn about wastewater and what that really is going to mean for how we are responding to the pandemic in our local areas. And I just wanted to briefly review some new data that has come forward regarding the effectiveness of the COVID-19 vaccinations in children and adolescents. And I gave a much more in-depth overview around children and COVID and the vaccine a few weeks ago. I linked to that prior briefing in the post. Part of the reason why I'm reviewing this today is not only because it's new data, but it's also because children in the United States are amongst the least vaccinated groups, despite the fact that we are still seeing COVID impacting the lives of children. I'll talk more about that in a moment. Currently, only about 5% of our under 4-year-olds are vaccinated, only about a third of our 5 to 11-year-olds, and only about 62% of our 12 to 17-year-olds have received their primary series for the COVID vaccine. This particular study comes out of Ontario, Canada, but I like the study because it gives us a good look at real world data using some of their public systems to look at cases as well as vaccination status for a large population. Now, Ontario does have much better vaccine coverage than in the United States for young people, but nonetheless, this analysis is useful to help inform us about the effectiveness of vaccination on children and adolescents. And this study was retrospective, meaning that they took a look back at individuals 4 to 17 years of age who had a confirmed case of SARS-CoV-2. So they had to have a positive PCR test. And they had 2 different time periods. One was May to December of 2021. So that was pre-Omicron. And the other is December 21 to January of 22. So that is during the Omicron period. And they looked at over 27,000 cases, which included 62 hospitalized young people. And what they found is that 2 doses of the mRNA vaccine was associated with an 85% lower likelihood of hospitalization during Omicron. And among children, 1 dose of mRNA was associated with a 79% lower likelihood of hospitalization during Omicron. And they did a number of different assessments to make sure that there were no factors that could be skewing the results. And they seem to have done a very thorough job of that. And so once again, we are seeing that the vaccine does an excellent job of preventing the more severe outcomes of SARS-CoV-2, even in children. Now, one thing we have to keep in mind is that we cannot compare children to adults. It's actually completely unacceptable the way that this is being done, where we see comparisons between hospitalization and death for children to adults. It's a completely different dynamic. We don't expect our children to die. We don't expect children to be hospitalized. And so it is a completely different expectation that we have when it comes to children. So when we turn now to the United States, we have experienced a significant burden of childhood hospitalization from COVID-19. In fact, over 189,000 childhood hospitalizations have occurred during this pandemic due to COVID-19. This is actually a very large number that exceeds hospitalizations from other causes that you may think of as more common among children, such as leukemia or other cancers. And I can tell you that each and every child hospitalization can have a very significant effect on the family and, of course, the child themselves, and this can be lasting. So every single one of these hospitalizations we should be trying to avoid. And with a safe and effective vaccine that can reduce the effect by about 80%, if we can reduce the risk of hospitalization through simple vaccination, why would we not do that? So the fact that we have such low vaccination rates for children in the United States is pretty inexcusable, and it's not something we should accept to stay like this. I will remind us that about half of the children who are hospitalized with COVID do not have any underlying condition at all. So we need to stop with this narrative that only people with underlying conditions are the ones who get hospitalized. We know that underlying conditions contribute in a much more significant way to the risk of hospitalizations for adults, whereas with children, only about half actually have any underlying condition. And even those that do have an underlying condition, the most common underlying condition is having been born premature for those under 2 years of age. And for those 2 to 17, it's asthma. So these are 2 pretty common things. So being born premature as well as asthma are relatively common. And these are also conditions where we have significant racial and socioeconomic disparities. So it's really important that we continue to get the word out about the importance of vaccinating not only our children, but also our pregnant individuals, so that babies are born with some protection as well, especially since they can't get vaccinated until they're older than 6 months of age. So we still have a long ways to go, but all of the evidence coming in is quite reassuring. And this specifically speaks to the role of keeping our babies out of the hospital, which is something that we really have no excuse for not doing better on. And now I'll end off with a bit of good news, which is that the White House announced launching a $5 billion program to address critical areas in need of investment in our fight against COVID. So first goal is to come up with a more variant-proof and lasting monoclonal antibody treatment. This would be so welcome because we know that we lost our monoclonals late last year because of the new variants. And what that means is we lost a really important treatment for those who, for whatever reason, cannot take Paxlovid. And we also lost what we call pre-exposure prophylaxis, which is designed for people with immunocompromise, people who don't mount a good response to the vaccine, or even people who cannot take the vaccine. We know that Evusheld, that monoclonal antibody, gave 6 months of protection against catching COVID. And now that treatment is no longer available. It hasn't been for a few months. So in many ways, those with immune compromise have truly been left behind because the vaccines may not work for them. And we lost that monoclonal antibody protection. So one of the goals of this $5 billion investment, and it's called Project NextGen, one of the goals of Project NextGen is that they will be funding the development of new monoclonal antibodies. That's great news. The second exciting thing that Project NextGen promises to fund is the development of nasal or oral vaccines. So we've talked about this in some detail previously, but the big advantage of having a nasal or oral vaccine is that it could provide what is called mucosal immunity. And that means that right there in your mucosa, like your nose or your mouth, the nasal mucosa or the oral mucosa is where it's actually where the virus enters into your body in the first place. And so this would actually give a more immediate layer of protection right there at the point of entry of the virus into your body. And this is something that cannot be accomplished with the intramuscular vaccines, the ones that we inject, the only ones that we have. So this would be a huge step forward and really great to see that there's going to be some concerted investment there. And last but not least, Project NextGen promises to invest in the development of a pan-sarbecovirus vaccine. So it wouldn't just be for SARS-CoV-2, it could be for all kinds of coronaviruses. It could also be for future SARS-CoV-2 variants. So instead of having to chase after them after they come, this would be a more proactive kind of a vaccine that will be able to cover a much broader range of coronaviruses. This last goal is probably the furthest out. For the monoclonal antibodies, I believe that we have the technology that's required, and this investment should help to fast track the development of the monoclonal antibodies that we need for the variants we have now. And this type of investment is not as big as the Operation Warp Speed, but it's still very significant at this stage. And this is how the government removes the risk involved for the pharmaceutical companies when the math isn't working out for them. And so hopefully this will encourage the development of new monoclonal antibodies quickly. Nasal vaccines probably are the next in line. There are some already in phase 3 clinical trials, like the one in India. Here in the United States, there are other promising candidates as well, but none of them have really had that major infusion or investment to get them over the finish line. So hopefully this investment will make the difference. And as for the pan-sarbecovirus vaccine, this might take longer. This seems like a much bigger endeavor, but it is really good to see a true investment of resources into this. What we're ultimately going to need is vaccines that can respond to more than just the spike protein. The vaccines that we have now are amazing. They're continuing to do their job at reducing the risk of hospitalization and death, but they don't last long enough. And the different mutations are helping to kind of get around the vaccines a little bit. And partly that is because these vaccines are really just focused on the area of the virus, the spike protein that mutates quite a bit. And so that's why we keep on seeming to be chasing after it. And it's also why it's not as effective, the vaccine is not as effective at stopping transmission as it was, say, for the original SARS-CoV-2 strain. So looking to the future, scientists will be focusing on other areas of the virus that don't mutate as much, or what we call conserved areas of the virus. And those are just areas of the virus that don't tend to mutate so much, but they're a little bit more difficult kind of targets, but maybe these are sites where we can focus future vaccine candidates. So overall, this is great news. It's welcome acknowledgement of where we are in the pandemic, which is that, yeah, we have some tools, but they're not enough, and they're not going to be enough going to the future. We had some tools that we've lost, like the monoclonals, like the Evusheld, and there's some tools that we've never had, but that we really, really need. And we need significant investment in order to continue this fight. Of course, we need investments in other things as well, continued communication and messaging about how to live safely, gather safely, be in our places of education and work and worship safely, improve indoor ventilation, better treatments, so that we can really slow down the spread of COVID and also reduce that death toll that we are continuing to experience. Because remember, despite any administrative action about the ending of the emergency declaration, we do continue to be in a pandemic. The World Health Organization states that the ongoing COVID-19 pandemic continues to constitute a public health emergency of international concern. This is the highest alert the World Health Organization can issue to the world, and it still applies today. And even though the emergency declaration is expiring on May 11th, there's still a lot of SARS-CoV-2 circulating around in our environment. We have a highly contagious variant that we're dealing with. COVID is the number 3 leading cause of death in the United States. It is also a leading cause of death in children. And we have an untold number of people with post-COVID complications like heart attacks and strokes. A still kind of unknown percentage of individuals who are ending up with long COVID. We still don't know how to predict who's going to get long COVID or post-COVID events. And so we still are just barely scratching the surface of our understanding of what is the cause, who is at risk, how to manage it. We have no treatment for post-COVID or long COVID. And until we do, I think it is a good idea to try to avoid catching SARS-CoV-2. By now, everyone should know if they're going to be someone who needs to take a treatment if they're positive. And if that is the plan, please make sure that you have this conversation with your doctor. You know how to reach them. You know how you're going to get treatment in a timely fashion, because remember, you only really have 5 days from when your symptoms start. So as soon as you start feeling symptoms or you think you're exposed, please go ahead and get tested. If you have symptoms and you're someone who should be treated, we really want you to go ahead and get that PCR test, because that will detect it early enough for you to get on treatment in a timely manner. And just like with most antiviral treatments, the sooner you start, the better. And so we're not going to wait to see how you feel. That's the opposite of what you want to do. You want to plan now before you even catch COVID, know what you're going to do, how you're going to do it. And then the moment you turn positive, you're going to go ahead and start on that treatment. And if you're not someone who's going to need treatment, and this is something you figured out with your doctor already, it still doesn't mean let all your guards down and just catch COVID repeatedly. We don't know how many times a person can catch it, but it does appear to be probably unlimited. And we are seeing some indications that repeat infections with COVID can have a cumulative effect and increase the risk of almost all the different post-COVID and long COVID types of conditions that we've seen, like persistent coughing or heart issues or neurologic issues and so on. So if you've caught it once, we don't want you to catch it a second time. If you caught it twice, we don't want you to catch it a third time, and so on, especially while there's still such little understanding about all these post-COVID and long COVID effects. One of these days, we are going to have a better understanding, and we'll hopefully have ways to prevent, ways to treat, but we are not there yet. So in the meantime, it does seem prudent to avoid infection and reinfection. So gather outside, improve your indoor air quality, wear a high quality filtration mask like a KN95, N95, N95, or KF94. Use rapid tests for pre-event testing. If you get exposed or have symptoms, repeat that rapid test every day or two while continuing to wear a filtration mask around others. Consider getting that more definitive PCR test, especially if you are someone who should be treated. Please don't go to work or show up at school feeling sick and exposing others. Stay home and rest. If you have to be around others, wear a well-fitted N95 mask. This is considered source control and can keep you from sickening or even killing another person. Remember that we want everyone to avoid losing their health benefits at this time. Medi-Cal redeterminations resumed this month. So if you are a Medicaid recipient, please update your information so that your state Medicaid office will know how to reach you. If you're in California, you can use the link that's in the post to update your contact information so that you'll get your renewal information in time. If you don't have a primary care provider, please get one. Know how to reach them before you need them. Make a treatment plan, get up to date on your boosters. If you didn't want the mRNA vaccine, you can go ahead and get the Novavax vaccine. Get your baseline labs checked, get your blood pressure checked, all those basic things that we really need to know, we want to know. We should all know where we stand. And remember to eat a balanced diet, consider a multivitamin supplement, get some fresh air. This weather is finally beautiful out here. Get some regular exercise. Unless you're not feeling well, in that case, please do get your rest, manage your stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thanks so much for joining us, and we'll see you again next Tuesday at 10 a.m. See you then.